Hi everyone, and thank you for coming to tonight's meeting, End the Social Care Disgrace, a meeting hosted by NACSLS, the campaign for a national care, support and independent living service. My name's Alison Treacher. I'm the Secretary of Care and Support Workers Organise, a group of care and support workers who came together at the start of the pandemic to fight for social support services which are fit for purpose for both care workers and those that we support. I'll be chairing tonight's meeting alongside Tony O'Sullivan, who is the co-chair of Keep Our NHS Public and the chair of the NACSLS Steering Committee. Can I just remind everyone to keep on mute so it keeps it nice for everyone? There's a few people still not on mute. That would be really helpful. So myself and Tony will take it in turns to introduce the sessions planned for tonight. I'd like to start with some housekeeping and to introduce our BSL signers for tonight, Emma and Craig. The signers should be pinned to ensure that they are visible at all times. The meeting tonight will be recorded, but if you don't want to appear on camera, then please turn off your screen on your computer. Please note that the chat function will be open for limited times during the break and at the end of the meeting. This is to ensure accessibility and to prevent people feeling overwhelmed by trying to follow the speakers and the discussion in the chat at the same time. If you wish or require, there are automatically generated subtitles which are available by clicking the CC button just at the bottom of your screen. There'll be plenty of time for questions and contributions from the floor, but please try to keep your contributions to around 3 minutes to ensure that everyone can contribute throughout the meeting. And finally, if you'd like to contribute, you'll be in charge of muting and unmuting yourself. And if you would like, you can use your little hand, which can be found in the reactions button to indicate that you wish to speak. If not, you can wave at me wildly and I'm sure I will see you. So welcome to tonight's meeting. What I'd like to do now is just give a brief outline of the running order of the meeting. So in our first session, we'll hear from 4 speakers who will outline the scale of the problems that we face and the government's response or lack of it to those problems. We will then hear from 2 speakers from the NACSLS campaign who will be explaining the aims, strategy and recent actions within the campaign. We'll then have a short comfort break before returning to hear Rachael Maskell MP, Labour MP for York Central, who will speak about the need for change and the response from the Labour Party. Finally, and most importantly, we'll have 2 plenary sessions where we'll be hearing from you. We want to hear about the work that you're doing both locally and nationally and what we need to do to influence decision making moving forward. The first plenary session will concentrate on national action and how, as a group, we influence change. And the second session, we will discuss and share information about what people are doing locally in their local areas and how we support each other whilst building NACSLS at a local level. The crisis in social care is deep-rooted and multifaceted, and bringing together all the stake, those who all have a stake in the future of social support services is such a necessary task. We have faced years of underfunding, privatisation, financialisation, but also a distinct lack of creative vision for the future of these services. This is why tonight we join together and learn from each other, and we must unite under one umbrella to ensure that we have a national service which ensures voice and control for those who use it, which tackles the care deficit, which leaves 1.4 million people without their needs being met, which rejects the term unskilled when referring to workers within the sector undertaking critical work, caring and supporting those who need it. We're here tonight to come together to build a campaign for a system which is fit for purpose, a system which provides quality support. So thanks everyone for coming tonight. And what I'll do is I'll hand over to my co-chair, Tony, who will introduce the speakers for the first session. Over to you, Tony.
Thanks very much, Ali, and thanks everyone for coming tonight, and thank you to the signers as well. Thank you very much. The four speakers will be, hopefully from their different perspectives, describing what they feel is wrong with the social care system and commenting on any on the government attempts to fix it, in inverted commas, which they've clearly failed to do. So the first speaker I'm going to welcome is Jan Shortt, who's a great ally on many fronts. She's the General Secretary of the National Pensioners Convention. The four speakers, unfortunately, we've only got about 5 minutes each, but we'll do our best to be succinct and then have good time for discussion later. So welcome to Jan Shortt. Thank you.
Thank you, Tony, and good evening, everyone. I'll just not repeat what Alison's already said about the state of care. I think we're all around this meeting understanding what it is. What I'm going to concentrate on is what the government hasn't done about it. And I want to look at what their small attempt at fixing care for good was. So in the social care white paper, just like the NHS reform white paper, it will not deal with the systematic inequalities in health provision, nor will it deal with the systemic vacancies in staffing in both those services. They missed the opportunity in the white paper to invest in recruitment and retention of staff in the care workforce, and that'll have a knock-on effect. There were vague promises about training and support for care workers, which is not enough to bring the crisis to an end. And even more vague promises around support for family carers, who actually currently save the government around £132 billion a year. The implementation of the Care Act in 2014, with full funding for councils to undertake assessments and provide much needed support to family carers, is a must, but again, it's only mentioned in passing. It changes nothing. Care will still be means tested. Individuals will still have to sell their homes to pay for it. The £86,000 cap on care costs is only operative from 2023. So those people who've been paying for their care over a number of years will have to continue to do so until they reach that new cap. The MPC is always aware that the £86,000 cap did not include what we call housing costs. That's rent for your room, food, laundry, etc. And you know, the government forgot to include it in the white paper, and they did that knowing that individuals will still need to sell their homes to pay for it. And the unfairness of funding for care has not changed either. Well, it's somewhat suspect anyway. Someone with cancer can receive all their care free from the NHS, but someone with dementia is means tested and can often end up paying for most, if not all, of their care. We've got equity funded providers like HC1 that have questionable financial structures. They gamble with the lives of people in their care. They don't post any profits in the UK, but they can still provide millions in dividends to shareholders. That is not what the essence of care should be about. Another missed opportunity to fully fund both the NHS and care. They're inextricably linked. And we're still the 5th richest country in the developed world, and radical change is affordable. And care will be subsumed into the NHS without proper funding sources and will become an even bigger lottery than it already is. The answer is a national care service, publicly funded, publicly delivered and accountable, free at the point of need, that puts people at the heart, offering choice and independence. Working alongside the NHS with a trained care workforce, paid on a grade allied to NHS staff, funded through general taxation and a redistribution of wealth. National Care Service would be universal and eradicate inequality and in access and give a better quality of life for all. In short, all the hype about reforming vision on care was nothing of the sort. It was all about the money and not enough of it. We need to fight for our NHS set up for the benefit of all and not for profit to go to private companies. Alongside that, we need to force the government to find a political will to radically change the care system through a national care service, so the people of this country can live healthy, and high quality lives. And I leave that there. Thank you so much.
Thank you. Sorry. Thank you very much, Jan. That was a great introduction to our speakers this evening. And the next speaker I'm going to race on to welcome Mark Harrison, who's the chair of Reclaiming Our Futures Alliance, an alliance of disabled people and their organisations. And Mark and others have been very helpful in shaping the demands of NACSILS. So welcome to Mark.
Great, thanks very much. And good evening, everybody. So social care is broken beyond repair. And like with Humpty Dumpty, it can't be put back together again, no matter how many king's horses and how many king men, in inverted commas, we've got. It needs to be scrapped. We need to start again. And that's the important message I have. And I don't just say that as a rhetorical thing, because disabled people have been discussing this and trying to implement it over the last 30 years, but more importantly, over the last 5 years, because we have a vision for a national independent living support service, which encompasses many of the things that Jan talked about. We think it should be alongside the NHS, but separate from. It needs to be organised nationally, delivered locally through disabled people, led organisations, peer support, co-ops and what have you. Where we have a slight disagreement, and we will continue to talk about this and discuss it, is that it needs to be run and controlled by disabled people. We need to learn the lesson, what's wrong with the care system. And what happened in the 90s to 2000s, where we got to a position where we had some really innovative stuff created by disabled people and allies, local authorities, leading social workers, commissioners, where personalisation, where personal budget, where direct payment, where disabled people were empowered to employ their own personal assistants, to deliver the support they want.
Mark, you're going in and out. Maybe if you just go on audio, it might be stronger sound.
Okay, I'll turn my camera off. So we have a vision for a completely different system. We think care is a 20th century solution and is outdated and outmoded. And there's a problem with care because 90% of care is privatized, and we need to separate out the relationship, which in terms of families and loved ones where we care for each other. And I'm not talking about individual relationships between social care workers and disabled people of all ages in care settings. I'm talking about care which is monetarized, which is for profit, which you have multinational companies and the City of London speculating and profiteering for their shareholders out of our care system. So those are the key things around the slight differences in our vision and the emphasis in our vision. But we shouldn't be under no illusion about the scale of the crisis. Disabled people of all ages and people who use care services have a perfect storm around them. Not only are they subject to the rising prices of food, the escalating crisis around heating and energy, but they're also being charged by their local authorities for their care. And local authorities up and down the country, some people may not realise it, are taking money out of people's benefits to pay for social care. So therefore, you've got thousands of people up and down the country but having to make choices about whether they receive social care, having been through an assessment under the Care Act and assessed as needing them, they're giving them up because they can't afford them. And this is a problem across every local authority in the country, but except for one. So whether it be a Tory authority, a Lib Dem, or a Labour-led authority, they're all charging disabled people for services, and they're taxing disabled people unfairly and robbing money out of their benefits to pay for it. Secondly, over the next month, each local authority is going to be setting its budget for next year. And because the Tory government continues austerity in relation to local authorities, everyone will be making millions and millions of pounds worth of cuts and passing those on through adult social care and children's services. So Labour authorities are going to be not only charging disabled people for services, but they're going to be cutting what's available and putting the cost of the crisis and the austerity onto disabled people. And the last thing I'd like to say around this is that, you know, this isn't us saying this. The Association of Directors of Adult Social Services last week or the week before came out and said they've got waiting lists of 150, 200,000 people, of people who are waiting for assessments or having been assessed waiting for services. So you're talking about hundreds of thousands of people, many of whom are moving towards the end of their life and will die on those waiting lists. So these are life and death questions. So I think the clear messages I have from disabled people, from Reclaiming Our Futures Alliance and from our campaign for a national independent living services, is that we need to unite in action to bring down this Tory government, because none of our care services are safe under this Tory government. But we need to reconfigure, we need to reimagine what our care service is about. We need to move away from care and talk about independent living and support. Thank you.
Thank you very much, Mark. It's very important, powerful messages for us to bear in mind throughout this meeting and beyond. The next speaker you've already met. I'd like to welcome Alison Treacher, who is a member of the Unite the Union and very active on a whole number of issues, but secretary of a relatively new organisation, Care and Support Workers Organise. Welcome, Alison.
Thank you, Tony. So I'd like to start tonight by thanking all the organisations and individuals who continue to work so hard behind the scenes at NACSILS. The task ahead of us is so daunting and the change is so necessary. I'll be speaking tonight from a worker's perspective and highlighting some of the issues that we face, our fears for the future, and briefly touching on the inadequate government response. The new white paper, which the government announced in November, seeks to cap the amount of assets being spent on care provision. But what does this mean for workers and those in receipt of support? Well, I'd argue very little. The social care cap disproportionately protects those with high incomes, with more assets, as opposed to those with low incomes who are likely still to lose everything. As the Resolution Foundation put it, if you own a £1 million house, over 90% of your assets will be protected. If you own a terrace house in Hartlepool worth £70,000, you can lose still almost everything. And I can assure you, I haven't met a single care worker with a £1 million house yet. Maybe our bosses, but that's another story. Johnson made very clear that social care will receive little from the health and social care levy for at least the first 3 years, as the lion's share of the levy will be used to clear the backlog in the NHS caused by the pandemic. This was a real blow to the 1.4 million workers in social care who have struggled on the front line throughout the pandemic, often on minimum wage, with poverty pensions, many not even guaranteed full occupational sick pay. We were waiting for the announcement which would help show us the light at the end of the tunnel. The announcement did quite the opposite. The sector is riddled with precarious contracts, with 2/3 of home care workers on 0-hour contracts, and the wages which we used to be afforded for sleep-in shifts are now being stripped away following the Supreme Court's ruling in March 2021, which means that we are routinely and legally paid under the minimum wage whilst working. Members of Care and Support Workers Organise have reported that they receive £30 a night for a sleep-in shift, which works out as little as £3.55 per hour. It's hard to imagine other sectors where this systematic underpayment would be permitted. Professor Lydia Hayes argues that this is the result of a gendered inadequacy of labour law, which devalues the work performed primarily by working class women. Government legislation has done nothing to address this. They avoided offering us a pay rise, but think they can tackle the crisis in recruitment and retention in the sector via a 3-week advertising campaign. The strapline of the campaign was, "There's no better time to be a care worker." Well, there's 1.4 million care workers who beg to differ, some struggling to make ends meet, having to use food banks and fearing for a future which sees hikes in national insurance contributions and fuel prices. Before the announcement regarding mandatory vaccinations for all workers in care homes and CQC registered accommodations, there was 112,000 vacancies in the sector, and in some areas of London, the vacancy rate stands at 9.5%, a level which undoubtedly already restricts the ability to deliver services safely. Whilst welcoming the recent government U-turn to enforce mandatory vaccinations on NHS workers, which would further entrench the staffing crisis, it's important to remember that on the 11th of November, we lost 50,000 colleagues. They were dismissed without any remuneration. 50,000 isn't just a number, it's years of experience and skill. It's meaningful relationships and friendly, consistent faces for those that we support. It's another 50,000 more empty vacancies, and it leaves over 1 million burnt out, stressed workers in understaffed workplaces, plugging the gaps of government failings. New legislation does little to change my material condition at all. Care workers, the majority of whom are working class women and disproportionately Black, brown and migrant workers, continue to be exploited to maintain a failing system. I think it's important to highlight at this stage how care facilities are both owned and controlled. Some of the main larger care providers are owned by financial investors that have earned substantial profits via opaque corporate practices. Private equity firms use complex business structures where increased importance is placed on financialized markets, institutions, and profit motives. These business models use finance to manage the risk with structures which prioritize returns for investors over the quality of care and support offered. They are willing to take on significantly higher levels of debt for acquisitions, capital spending and expansions, and often seek to restructure, remodel and expand these companies within 3 to 5 years before selling them on for profit. This turnaround is purely to maximise money for investors and hardly conducive with sustainable quality care provision. We need a system which prioritises people, not profiteers. We need a system where workers and those where we support are valued as experts. We need a system which is democratic, participatory, and values the experiences of workers and of disabled people. We need a national care, support and independent living service. And I, for one, am willing to fight for one. Thanks everyone for coming tonight. Thanks.
Thank you very much indeed, Ali. That was great. Thank you. So we've had the perspectives from Jan and the huge population that she represents in the National Pensions Convention. We've had Mark representing the interests of disabled people, and we've had Ali representing the interests of the hundreds of thousands of care staff. And we're now going to Professor Tony Evans, Professor Tony Evans, welcoming you. Tony is the co-chair of the Labour Social Work Group, so welcome.
Thank you very much. And thank you for, as I was saying, to John, Alison and Mark for the sort of overall picture they provided. I'm just talking now about a narrow section, but I think it sort of reflects a lot of people's experience. And as Mark was saying, the directors of social services to point out the number of people who've been waiting for assessments and the lack of staff to undertake assessments. And this sort of just underlies, you know, the basic tension within the social care system, because care as a right isn't recognised, it's just treated as a resource to be rationed. And what the directors of social services have acknowledged, I suppose don't really address, is the fundamental problem of the system, where, as they say, every day, directors, social workers and councils have to make invidious decisions about who gets care and support. And the problem is funding and inadequate funding. But as the other speakers have been saying, it's not just that. It's about a fundamentally broken system, a system which has been designed and run over the past 30 years to manage inadequate funding and to try and cover it up. And in doing that, to try and heap blame on frontline workers, people who are using the services, carers and communities. The original idea behind Tories of community care reforms was to shift funding, which was based in benefits, for instance, around residential care, onto local authorities to ration, and in that to shift the possible blame for rationing. But there's also a strategy to promote markets, to make citizens into consumers, to exploit workers, to shed rights, and to push responsibility for care onto the people who need it most. So social workers, I think our perspective is that they shouldn't really be involved in assessing people who know very well what their own needs and strengths are. Care is a right. And as with the other elements of the social care workforce, social work is a very small part of it, but it reflects the same experiences of being devalued, overloaded and unrecognised. And as part of the process of what's happened over the past 30 years, we feel that social work has been sort of distorted through central government action into a reserve of rationing and investigating and safeguarding, and being forced to lose many aspects which are valuable. An example of, say, how social work is currently distorted is around the government's promotion of a very strange idea of strengths-based and assets-based practice, which is about basically, I suppose what Mark was talking about focusing on trying to exploit people who need care by looking at their assets, the family's assets and neighbourhood's assets to make up for gaps in provision. But we argue that really social work should be working with communities, but this has been something which has almost disappeared. And the opportunities for social workers to work positively with adults, carers, has been curtailed by this focus on rationing and trying to address the problems of austerity and underfunding. And this really undermines what we see as central to social work practice, its commitment to advocacy, to promotion of rights, to challenge discrimination, and to promote and work with people who use services and to work with carers as well. I just want to close too with an illustration of one of the problems with something that's happening currently in social work education, which I think sort of captures really the government's approach. Local universities have worked with employers to create routes for care workers, for instance, to train as social workers, to involve people with lived experience and coming from diverse communities, to involve both in training and becoming social workers, but also to look at how courses reflect lived experience and diversity and address structural problems. What we've seen with the government is over the past 10 years, promoting funding into fast-track programs promoted by think tanks, consultancies, to produce practitioners who can manage social care and manage people who use social care. It's a classic Tory smash and grab raid, where, for instance, now they're issuing a consultation on a bid that they want for £80 million to raise market awareness and to identify providers who can develop, provide, and exit fast-track social work provision. Okay, thanks very much.
Well, on that horrifying note, thank you very much, Tony, for your contribution. It reminds me of when I was working, and part of my work was in adult learning disability services. The manager proudly announced that social workers were now micro-commissioners, and he thought that was a great thing, but basically they are the controllers and the rationers too often, even though that's not what they want. Thank you very much. I'm going to hand now back to Ali, who's recovered from your great speech and playing a new role. Thank you.
Thanks very much, Tony. And thank you, Mark, Tony and Jan, for some brilliant interventions. So the next session, we will be hearing from people embedded in the NACSILS campaign, and we'll be hearing about the aims, strategy and action, most importantly. So I'm going to take this opportunity to hand back to Tony O'Sullivan, who is the chair of the steering committee of the NACSILS campaign, but also the co-chair of Keep Our NHS Public. So over to you, Tony.
So thank you very much, Ali. So a national care, support and independent living service. It doesn't exactly roll off the tongue, but NACSILS is, if we ever win it, something that we would like to be equivalent in familiarity with the NHS. This is what we want. Social care has never been put on the same basis as the NHS. And as we've heard, medical conditions like dementia were recategorized as social needs, mean tested, and the people charged for support. Support for independent living for disabled people has never been adequate. Before I retired, I was a consultant pediatrician working with families and children and young adults with disability who are disabled and with their aspirations for leaving childhood to go into adult life to live an independent life ahead of them. But despite periodic reports over decades, there's never been a nationally mandated set of services guaranteeing good quality support for independent living. Now, in the first year of COVID, the total failure of the system that we've been describing was exposed as nothing short of lethal. 47,000 residents died in care homes. Over 20,000 people died in their own homes. 6 out of 10 deaths were disabled people. Scandal after scandal emerged as those placed at such risk were frankly discriminated against from the impact of COVID. And 1,500 health and care workers have died as the result of being frontline workers. The issues are not new, and they've been very well described by the speakers tonight, but we are at a crisis point. So over a year ago, Keep Our NHS Public and the Socialist Health Association, disabled activists, including Mark, whom we've heard, National Pensioners Convention, the Women's Budget Group, GMB Union, Doctors in Unite, and others discussed what a campaign could have as our core demands that would unite our efforts to transform this disgrace. So there are many things potentially to disagree on. There's real arguments with substance about terminology. There's divisions about where care services should sit, whether within the NHS or as a separate new national service, which is what I would support. And there's disagreements and worries about the role of local authority in controlling or monitoring services. But those things are an ongoing discussion, and they're partly for the present discussion and for the future to be played out. This is what we agreed on now, though. We adopted 7 principles and the demands that go with them. The first two are really linked to the model of the NHS, that the government should nationally take responsibility and legislate for a national care, support and independent living service, and it should be funded nationally from government funds and progressive taxation. And it must be available to all living in this country, free at the point of their need. And that's not fanciful, because that is what happens in Scotland now. That is possible. It's a political choice to deny it. We've seen profiteering in social care, and with COVID, how the government and an underfunded, privatised, fragmented care system utterly let down care home residents, those needing care at home, disabled people and care staff themselves. So our third demand is that the service should be publicly provided and publicly accountable. And number 4 in our demands, with a national mandate from government, but local agency to plan and deliver the service through cooperation between users, organisations of disabled people, older people, and local authorities and other key stakeholders that are not there for commercial interests. We've heard about the pressures on care staff. Pre-pandemic, there were 120,000 staff vacancies, and it's probably worse now. Staff are often abused, as Ali's told us, on 0-hours contracts, very low pay, very little training. And in addition, 5 million informal carers, over 60% of whom are women, are ignored and exploited by the current system. So our 5th and 6th demands are that there must be a national NACSL's employee strategy fit for purpose, with a career structure, decent pay and training. And also informal carers must have their needs recognised and addressed, not as an option, but as a mandated requirement, as a key part and responsibility of the national service. Now, we know all this is ambitious, and we know that the ambitions of many people in our alliance are greater than we can achieve in a short time. We know that. But the commitment to the principles of working together in co-production should be given life in an ongoing task force on independent and supported living. And that's our 7th demand, that we make real, we do not forget the important issues where we're going to try to transform social care and independent living services in the future. NACSLs, that's National Care Support and Independent Living Service. We now are into our 2nd year. We've got a website and social media set up. We have 3 work groups that focus on working with politicians and civil society and campaign organisations, trying to spread our influence. A 2nd group working with trade unions to build support in the trade union movement for a fit-for-purpose care service alongside fit-for-purpose terms and conditions for staff. And a 3rd work group that's working on our publicity, that has made those achievements that I've talked about, the website and so on, and working at promoting the aims and the influence of NACSLs. We are ready to look for wider support now from individuals to get involved, and we ask you all here to think about that, to get our demands out there and to win people and organisations over and win political arguments. And we know we're not alone in that, but we have our focus in our NACSL's 7 demands. We're up against a dishonest and undemocratic government. The health and care bill that's going through Parliament at the moment threatens the integrity of the NHS. It does so very briefly in some ways. It deregulates national standards of professional skills. It can do that without any further recourse to professional bodies. It can limit access to treatment. It can threaten to share patients' data with commercial interests. It will arbitrarily bar access to care costs until an individual has paid out over £86,000 on their personal care. Keep Your NHS Public opposes the health and care bill, as we also campaign to protect and fund the NHS properly, and as we campaign to fight for a national care, support and independent living service. So I'm saying that because we've got several battles all at once. They're interrelated, But now, can you please join us and help us focus on this current one, the campaign for a national care support and independent living service? Thank you.
Thank you so much, Coney. You covered so much there. Brilliant. I'm going to quickly hand over now to Don. Don O'Neill, who is a disabled activist, an author, and a member of the NACSIL Steering Committee. Over to you, Don.
Thank you very much, Ali. Yes, there are many people out there who do not get the care they need. Sometimes they refuse the care they should have, or sometimes the care they have, the amount is being cut. I know where I live in my area, one of the tactics used to reduce people's care is to just cut their night care and say to someone, oh, we're going to cut your night care, and what you can do instead is just wear an incontinence pad. I know someone had this actually done to her. She was told, you don't need night care anymore, so just wear a night pad, even though her night care was not just toileting. And her care funding was reduced from £850 a week to £430. Imagine that overnight, £850 a week to £430. The problem is with this woman, she did not challenge it because she didn't have the confidence to challenge it, and also didn't know she could challenge it. And the people like her who don't have that confidence to challenge, or know they can challenge, or have that support to challenge, they have to just suffer these care cuts. And it's really, really bad. And it shouldn't be that way. I do often feel that the amount of care you actually get depends on how belligerent you are. You know, the more belligerent you are, the more demanding you are, then the more care you get. Essentially, it's like a postcode lottery, but it shouldn't be that way. Everyone who needs that care ought to be getting that care. So I feel for NACSILs in the short term, some of the short-term campaigns, there are two things they can focus on: support and also getting service users involved. So in terms of support, there are many people out there who need support to take, for them in their needs assessments, because often in those needs assessments every year, your care budget can be cut. And if there are outcomes that you don't like, people need support to actually challenge those outcomes as well. And again, it's knowing that you can challenge them and having support to challenge them. People also need support to actually manage their care package, manage their budget, manage how they find carers, manage how they employ carers. I know a number of people who actually get a direct payment for their care, but they have no idea how to find a carer. That kind of information, that kind of support should be there, but unfortunately, because these people have no idea how to find a carer, they have to put up with care agencies and carers that they do not like. That is terrible. It's outrageous. The second point is service users must be involved in the way that adult social care is administered. I mean, yes, we all know that local authorities need more money, but they could do better with the money they have. And the best way to do that is to get service users involved. And I don't mean some kind of meaningless co-production exercise. I mean getting them involved on a day-to-day basis to run services better. So whenever they commission a service, for example, rather than commission the service and then ask people, oh, how did you find this service? They should have people involved at the very first stage, when there's a blank piece of paper to help create that service, help shape it, then they can take part in the interview of companies who might provide that service. Now, on a day-to-day basis, adult social care could be so much better if service users are involved. And for me, the best way to provide best support for adult social care users and the best way to get service users involved is by user-led organisations. Every local authority, I feel, ought to be mandated to fund user-led organisations, their own local, in their area, a centre for independent living, because people who work in these user-led organisations, they have the personal experience of going through the system. They know the questions that should be asked. They know what needs to be done. And I mean, there are now anyway, across the country, some great organisations who are showing how it could be done. but this should be replicated throughout every single local authority. And that would make adult social care so much better. And with support, with service users involved in running the system, and with better support for adult social care users, things would be a whole lot improved for people who use adult social care now. So support and sense of independent living are things that could be campaigned for right now. Back to you, Ali.
Thank you so much, Don. So much raised in that contribution. Yeah, and absolutely highlighting the need for user voice in, in our system. So I would like to, instead, we were due to have a short break, but what I would like to do is ask Rachael Maskell, who is the MP for Central York, to speak with us about the current situation in social care, but also the response from the Labour Party. And then we will have a short 5-minute comfort break afterwards and come back for the second half, which is the plenary. So over to you, Rachael. Thanks very much for joining us.
Thank you, Alison, and thank you everyone for being here this evening, and what excellent contributions we've had so far from everyone. I have to say, it does sum up, what's happened over the last 12 years of this Tory government. Social care has been so neglected, and of course we see that pain day by day in our surgeries. The cases which come to us where people are really, really struggling either to fund their care or to receive good quality care, and that's no disrespect at all to people that are just set the impossible challenge to provide care. And I just want to start with people who are carers, and first of all, the fact that things like respite has been taken from you and all of those challenges, we've got to put through a system that puts you first and foremost. It was astounding that the government brought forward a care strategy and had no regard for carers who provide the vast majority of care, let's face it. And that just said to me everything about their understanding about social care. So of course we want to make sure that carers are properly supported, that they have funds. I mean, the fact that you get such little money through social security if you're able to claim carers allowance, and then no support. And often it is just getting an hour off is what you need to recharge. And of course, when you don't recharge, you yourself also face multiple challenges, and it is really, really hard out there, the isolation, all of the issues that go with that. So we want to make sure that carers get the care and support that they need and jolly well deserve. I then want to turn to the staff, and it was back in when Andy Burnham was the Shadow Health Secretary. He set out a piece of work to have a look at what's happening with the care staff, and it was a good piece of work, and I think it still stands today about the main things that we need to do. First of all, we know that care staff are so disregarded by government in pay, in conditions, and it is incredibly gendered, and we shouldn't shy away from that argument, but take it on. And we need to talk about the care profession, and I always talk about care professionals, because that is exactly what you are. You approach your work with a professional attitude, and you want to do the best for those in your care. And I think changing the language is really important around this, because it's almost in government terms, it's like, if you do not have a degree, it's almost like, and working in a health or care role, then it's of little value. So I think we've got to change the language and create our own language. Secondly, I think we should call for regulation as well. Often people are seeing service users one-on-one in their own homes and do not have the protection of regulation. And again, it not only raises the professionalism, but it does the protection. So I think that's really important that we talk about regulation and what that regulation around care should look like. And of course, as has already been mentioned, people are being, we're seeing that kind of statutory regulation being undermined by the current health and care bill. And then we need to put proper training in place, allow staff paid time off to have training and support. And I think that paid is really important as well, because you want to provide the best care. And if you're going to provide the best care, of course, we need refreshers and updates and support and induction. And that's really important. But there are two fundamental things that need to be addressed. One, there needs to be a workforce plan, and government need to bring that forward. Now, it's quite interesting, Jeremy Hunt, now as chair of the Health Select Committee, he's talking about workforce planning, mainly for the NHS, I have to say, but I think there's an open door in pushing the Health Select Committee to look at the care workforce as well, and to look at a proper workforce plan for the care sector. And secondly, pay. We know that until and unless there is a national pay agreement for care staff, we will see people paid on those minimum wages. And of course, for many people, that travel time is still not paid, and other things are not included. And therefore, we need a standard. I argue that Agenda for Change is a very good package. And if we are to integrate health and social care, what could be better than extending Agenda for Change to the care professionals delivering those services? And I think that's what we should say, is that if you provide care in the community, that care should be no less value than the care provided in the NHS. So let's bring it all together and argue for Agenda for Change for our social care professionals. And finally, on the point of vaccination, many of you know we're not yet over the hurdle of that. I mean, I have absolutely fought as hard as I can for the unvaccinated. But just to say that we still need to argue for reinstatement and continuity of service. This is really, really important, because at the moment people have dismissal on their reason for leaving, and we need to see that overturned. So there's a bit of work still need to get that over the line to ensure that those 50,000 people who served us incredibly through this pandemic and then were bullied and sacked, we need to get them back into their jobs, the jobs that they loved and dedicated themselves to, and to see that compensation brought forward. So we haven't given up on that yet. When it comes to domiciliary care, the whole system is broken, and when we come to care companies, domiciliary care companies, again, the whole system is broken. I don't think personally it is repairable, and I don't think we should be looking at repairable. And a lot of the estate that is being used, it creates a passive model of minimal care. And I think we should be setting the standard of that. We want something which is participatory, provides for independence, provides for dignity, and therefore to reimagine what we want from a state and how we want that care and support brought into residential care, but also a new model for domiciliary care as well. And that's not in these profit-making companies. They have no place whatsoever in our care system. It has got to be under public hands, and nothing else will do. And I will fight for you for that. And therefore, when it comes to who does what where in the system, and that's the big question, isn't it? And I think we should be seeing the national determining the what the standards are, setting that bar, and then locally determining the how that's going to be delivered, because that's about your local services coming together to provide the very best. The last point, of course, is coming back to money. And we saw that forced vote on the social care levy, and let's face it, the Prime Minister that weekend was given a coin and he tossed it, and how it landed was what we ended up with, and it was a social care levy, and then it was forced through Parliament without proper scrutiny at great speed. And of course it's going to come in April, but not go to social care, not a penny. It's all going to go to the NHS to clear the backlog, apparently, when they don't have the staff to even deal with the crisis at the moment. But we'll hold them to their word on that. But we have got to look clearly, if we're going to bring health and social care together, the only way to do it is to have one system. We've got these ICSs now, not accountable, but they've got the responsibility. They haven't yet got the political mandates because the legislation hasn't gone through. But the government will force that through, we know, as they did by the way of the CCGs, which was the future and seems to have lasted less than a decade. But the ICSs themselves, we need to get a hold of them around the integration agenda, and we need to make sure there are people on the boards, on the wellbeing boards, the health and wellbeing boards, and also really pushing into that space and demanding who are sitting on those positions, who is controlling it, and ensuring people with lived experience, people who are disabled or who are elderly or requiring social care, wherever that comes from, that they also have a real voice in the care that they receive. And therefore, I say that we need, as you have set out so clearly, it's got to be fully publicly funded, fully under public accountability, no more of this private profiteering out of the frail, out of the sick, out of the elderly, out of the disabled people, and ensure that we have that accountability built into the system. Ultimately, we need to make sure it is free at the point of need, as is the NHS. There is no difference in a service. We have got to say it's about a service around dignity, about people's opportunity, and talk about its future. So there's a big agenda there. Just, if I may be indulgent on just saying about some practical steps there, I think there are processes in Parliament that we could use around this. We're coming to the end of this parliamentary session, but let's look to the next. I think the renationalise the NHS bill, can't remember quite its name, but I think it was very effective at keeping this issue live. I think we should look perhaps at a National Care Service Act or something along that line to aim for, so bringing a bill into the next Parliament to get this agenda talked about and focused. I think we should ensure that we get constant debates on this issue. Let's push it up that political agenda, so government have to debate and justify the steps they're taking, but also for my front bench too, I know that they want to bring us a fresh service, bringing dignity and respect to people, but let's make sure they land in the right place too on this. We may be a year out from a general election now, thoughts are coming together, let's shape that agenda and make sure we get it right for everyone.
Thank you so much for joining us, Rachel, and thank you for highlighting the Labour Party thinking about the way forward, and lots to think about. And so once again, thanks for taking the time out of your busy schedule to come and join us. So what we're going to do now is have a short 5-minute comfort break. So we will be coming back at 8:05, and we can be discussing what some of the speakers have mentioned, but also talk about what's going on locally and what we need to do nationally to push the agenda of the National Care Support and Independent Living Service. Friends, we are just about to reconvene, and thank you, Mike, and I know that Jean's probably on the call, so there's definitely going to be time now to take contributions. So the first kind of plenary, and we're going to spend about 25 minutes talking about suggestions about things that we should be doing nationally, and hopefully we'll hear some people from the campaign about what they've been doing, but also sharing your experience from your various organisations about what you've been doing at a national level. And the second plenary will be doing what we're doing locally. So I can see 3 hands up already. So I'd like to hand over, can I take Jackie and then Jenny and then Charlie? So Jackie, can you unmute yourself? And then if we keep our contributions to about 3 minutes so we can hear from lots of people from the floor about what we should be doing nationally to build the campaign, and also what we're doing in our respective organisations nationally to improve social support services. Over to you, Jackie.
Thanks very much, Alison. And I must say, listening to everybody helps me realise how important it is to get involved in this campaign, and helps ratify why I'm actually involved in a local campaign as well, which is Reclaim Social Care Greater Manchester. We actually set up in May 2019 from a Dignity Action Day leafleting of members of the public. And we heard then that there was, first of all, very little awareness of the issues, except from people who had to struggle to fight to gain any kind of support they needed, either as informal carers or for the people that they were looking for help for within their families. And they found it something of a minefield to actually gain any support. So we have since then set up a local group in Greater Manchester. We've done various campaigning things, but it would be helpful to know if people can point us in another direction to really achieve the radical changes that we do need. Some of the things we have done, we compiled a petition to Andy Burnham, the Metro Mayor, which was fairly successful, only in the fact that he agreed with all our aims. We met him at a local meeting, and he said that he would support that, and he would also involve service users, care workers and unpaid carers in the vision for social care in Greater Manchester. However, he felt he couldn't change anything with the present government. So that is obviously one of the main things we need to do. We've done leafleting of the public, we've been involved in press releases, supported, I'm pleased to say, and got support from the Charlie Hospital campaigners, from Caswo, Keep Our NHS Public, and we've also gained links within Unite and Unison. We've been pressing for action also within associate and retired members sections of Unison, GMB and PCS unions. Unfortunately, our achievements have not always matched our efforts. Whilst we've reached a lot of people with the petition, we only got around 500 signatures. We contacted local councillors and MPs. One person contacted 73 people and only received 3 holding responses. But now we do feel it is time to make that contact again that Rachael Maskell mentioned. At our latest meeting, we've agreed to write to MPs and councillors because elections are approaching. We want to ask for support for the National Care Support and Independent Living Service, for questions to be raised in Parliament. We intend as well to raise some of the issues in the news at the moment, which have an impact on people's ability to get the support they need, such as the pernicious cost of living rise. There's an acknowledgement the care sector has recently lost thousands of staff. There's concerns about discharging people from hospital before they're assessed for support at home. And there's also the unpopular increase in national insurance, which we've already heard will not cover what is needed to run the service as it exists, let alone to make radical changes we can see are needed in our society. So I think there's things there nationally we can do, but I would welcome any thoughts as well that others have on building the campaign locally.
Thank you very much, Jackie. Can I just remind everyone, I think you've raised loads of important points and also raised about how the national and local campaigns work together. Can we try and keep our contributions short, because I've got lots of hands up now. So Jenny and then Charlie, and then we'll go to Larry, please.
Hello, yeah, I'm Jenny Hurley. Excuse me, because my connection will break up if I put my camera on tonight. I'm having a few problems. But I'm from the Chorley Inside Tribble Hospital campaign. We've been an NHS campaign fighting for local services for 6 years. We're part of Health Campaigns Together, which is associated with Keep Our NHS Public. As Jackie said, we're trying to support her as she has supported us over the whole years, you know, from the same area. My question, I think, you know, obviously we are very interested in supporting your campaigns as much as we possibly can within our own. mainly due to the fact, I mean, one of our big bugbears is about bed blockers, and it's about too many people going to hospital unnecessarily. Now, if social care was in the state it should be in, the NHS wouldn't be like trying to make all these cuts because of those two very reasons. So we are very interested in supporting your campaign. We support each other. My question I wanted to ask was, are you interested? We've had environmental groups and various other groups in the area in the north in having some sort of protest in Blackpool for the Conservative Party conference, which is being held on Friday and Saturday, the 18th and 19th of March, to highlight our obviously concerns over our various areas. And would somebody be interested in being in touch to sort of coordinate what we can all do together regarding that? I've had quite a lot of messages tonight because of that from different areas, so I think it would be a really good output for this cause if we could get that up there as well. So that's all I wanted to ask. Thank you.
Thank you very much, Jenny. And I'm sure there's people on the call absolutely ready to protest outside any Tory party conference. Thank you. Over to you, Charlie.
Yeah, solidarity, Jenny. I'm in Barnet, so I'm a bit far away to get there, but I would be there if I could be there. Yeah, I just wanted to bring up, I'm from a group in Barnet called, which is in North London, called Barnet Forum for Independent Living. And we are in the process of launching what we're calling the Campaign for Real Care. And this links in really well with what Don was talking about, which was this real need, like an immediate need for supporting people with their assessments and with their self-assessments, and how much essentially local authorities are getting away with giving the impression that they're meeting people's needs when actually what they're calling them, the eligible needs, are nothing to do with the areas of well-being under the Care Act. So what our campaign is about is really empowering people to feel that they can take on their self-assessments with the right support, and really express their needs to their social workers, and also ways that they can challenge their council on decisions. So this is very much linked in with your campaign, which we fully support, and just wondering whether there's ways of, again, as Jenny was asking about, linking up, just because this kind of thing is a kind of immediate thing and actually feeds into the overall issue of the cover up around money, and how money basically determines how much support people receive. And that if people really knew, even if we at the least knew what the shortfall was in terms of how much money is actually needed, that could go a long way towards supporting the national campaign for this service, and really understanding the gravity of what's needed, but really empowered by people who use the services. So
Thank
sorry.
you. So no, don't be sorry. Thank you so much, Charlie. Really important contribution, and absolutely we need to hook up. That is why we're here today, to find out about those local campaigns and work nationally towards a better system. I've got Larry, then Helen, and then Gordon, and then can we keep our contribution short? I don't like interrupting people. Over to you, Larry. Oh, you're going to have to unmute, comrade.
Okay, just to report something that I'm really very pleased about, which is that at its October conference, the Green Party of England and Wales passed a very strong policy for free social care at the point of use, publicly provided, and very similar indeed to Naxos, with the exception of the ongoing working group that you proposed, which I think is a very good idea. It's one of the advantages we've got is we're rooted in the disability group of the party, which has, of course, as any large group of people, thousands of disabled people in the party. So it's not just floating as a policy thing, which is something that happens sometimes, but it's actually rooted in this in the disability group. I've been pleased to see that we've been mentioned and supported in the House of Lords by one of the Green Party lords. It's a strange thing to have a Green Party lord, but it's better than to have them saying brilliant things. I'll leave Helen Rowlands to talk about the campaign she's involved with around councillors, local councillors not passing charges increases. We can't change the system overnight, but local authorities can refuse to raise charges. Charges are not required. The local authority can charge, but it doesn't have to charge. And there is no particular reason except the usual political problems not to oppose increases in charges, because everybody knows how desperate they are and how bad they are for so many very needy people. So thank you very much.
Thanks very much, Larry. I'd just like to highlight, if everyone who wants to remain in contact with the campaign, if they could please leave their details in the chat, which will remain 10 minutes after the end of the session at 9, so we can make sure that we've got your contact details and reach out and do joint work together. So after 9 o'clock, please do put your details in the chat and we will be in contact. Over to you, Helen.
Thanks very much, Ali. So there are a couple. I'm one of the co-chairs of the Cheshire Disabled People's Panel, and the other co-chair is on the call as well. That's Lynn Turnbull of Disability Positive, formerly Cheshire Centre for Independent Living. Couple of points that I'd like to share with everyone. The first one being that the unions, I'm a member of Unite, fully and totally understand the CASWO position and indeed support it. But I want to raise this point. The unions are brokering ethical care charters across a number of local authorities, and the example that I'm going to share with you is that of the Leeds City Council, which brokered one of these charters with the GMB. Now, we've done a series of Freedom of Information Act requests to find out the extent to which local authorities are raising care charges for the disabled and elderly people that they charge for meeting the statutory care and support needs of. And we found that Leeds City Council have raised their care charges very considerably since 2018. And I want to issue a warning to everybody on this call that we must be absolutely vigilant as trade unionists and as disabled people's rights activists and allies, that the wholly necessary demands for improved paying conditions for the care sector workers, they cannot come at the expense of disabled people who are being charged by Labour-led local authorities for the meeting of their statutory care and support needs, okay? I wanted to make that point, and I'm hoping that Rachael Maskell is still on the call and will convey what I've just said to Steve Reid MP and to Wes Streeting MP and to Corinne Smith as well. The second thing that I wanted to say is that Disabled People Against Cuts, along with Inclusion London, ROFA and Win Visible, who are on this call, and many other disabled people's organisations and grassroots activists, are working on a campaign, a national campaign, to end the charging of people for meeting their statutory care and support needs, and as an interim set of demands, and to respond to the escalating and intensifying cost of living crisis, which disproportionately impacts disabled people. We are asking the local authorities to freeze social care charging in the 2022 budgets. We're asking them to exercise their discretionary powers under the Care Act to issue discretionary uplifting of the minimum income guarantee and the personal expenses allowance. And we are asking them to set about making sure that the people that they're charging for care are well aware of their rights under the Care Act to submit to the local authority their disability related expenses, which in law can be offset against care charges. So what I'd like to do is to email Naxals with those demands. Green councillors are making those demands for us across England. We need support from the Labour Party. So if Rachel is still on the call, Rachel, can you please get these demands from Naxals, and can you please do what you can with LGA Labour to get action on that? Thank you.
Thank you very much, Helen. What a brilliant contribution, and definitely do contact the campaign, and someone will be in contact, and please do leave your details after 9 o'clock. We've kind of made an executive decision that we're going to merge the plenaries together. There's so many hands up. There's so many great contributions. What I will ask is if people can speak a little bit slower, so our BSL comrades, signers can keep up with the chat. So I have Gordon, and then I'll take Joe, and then Sandra, please.
Hello, I'm Gordon. I'm a member of Haringey Unite Community Branch. I used to be a social services director. 2 or 3 points, I think, where we could have some real leverage. Rachael Maskell has opened the door to a bill in support of what Naxal's demands are, basically, I hope, a national care service and support for independent living. So I would like to propose that we actually take that up actively, find other MPs as well as her who would be prepared to be in some kind of working group to help devise a bill for the next parliamentary session, because this is obviously timely for it. I'd be happy to help on that. I helped when I was a director on the 1989 Children Act. I've got some experience of doing things like that. Secondly, in April, prior to the elections for the local authorities in some parts of the country, quite a lot, we could be doing an April webinar on the campaign we wish to pursue. So I think it's a question of timing, really, I'm saying, as well as leverage for the new parliament, timing for April, and getting would-be councillors, putting them on the spot where they, if they're seeking re-election, will they support Naxal's demands? And thirdly, I think on more local but also national level, co-production, getting beyond the rhetoric. We've done quite a bit in Haringey on that in terms of a new home care service, which has an ethical care charter devised by Unison as part of the contract, with many fewer people who provide it. It's not in-house, but it's towards a more localized relationship-based service, not just a transactional service, because social care and support isn't about transactions or market forms. It never should be. It certainly wasn't in 1970 when I was a community social worker. And believe it or not, we had aspirations for a universal service then, and a lot better than has happened in the derogation of the last 30 years. So we do need co-production beyond the rhetoric, and there's some good experience in home care on making the closure of an old people's home, stopping that happening and turning it into a co-production of a new home, which we're now doing at Osborne Grove and Haringey, with carers and users working with local authorities in an equal partnership round the table on planning, designing and delivering. So it is possible. There's some good examples in Haringey and elsewhere in the country in co-production. I'm happy to talk more about that. I'll put my email in the link if people want, on getting beyond the rhetoric of co-production and taking up the ideas that have already been expressed this evening. There is some examples. Thanks.
Thank you very much, Gordon. Some really interesting points. I echo what you're saying of co-production. We're going to have Joe, then Sandra, then Adrian, please.
Okay, I feel quite humble here because I'm behind everybody else, I feel, but my points are kind of personal, in that I think that we ought to be making more use of individual carers. People actually become carers by accident. They kind of fall into it because something horrendous has happened. And what I found when something horrendous happened to our family 17 years ago is there's an absolute dearth of information and nobody seems to want to give you it. And what we need is to get the information out there to people who are at the beginning of their caring journey so that they know what they should be asking for. from the powers that be that are providing it. I've had a recent experience here. I mean, I've had 2 years where I've had no care at all because it was withdrawn at the beginning of the pandemic due to lack of PPE, and it's never been replaced. And I'm somebody who's on the health service track, so it's all funded, the funding's there, but the care isn't. And I was recently told that our individual service plan was going to be reissued, but that the night care drop-in service was being taken out. So my night carers were expected to work from 10:30 till 7:30 without a break. And I'm sorry, it's not legal. And I won't stand for it. And I think people need to understand what the law is and what they should be pushing for in terms of what goes into their individual contracts. Anyway, I'll leave it there. I think we need more information out to people so that helps them in their arguments.
That was incredibly eloquent, Jo. And like our sisters that came before us, the personal is political. So thank you very much for your contribution. Sandra.
Hi there. I'm a disabled person myself and also the facilitator of Act for Inclusion. And we believe that the word care is quite an oppressive one. What we believe it should be, instead, what it should be is about support. And we also believe that the care is a loaded word because it's about people looking after you when what is needed is independent living and people to have self-determination, but support to be able to live their lives the way they do. So that's the first thing I'd like to say. So independent living is about you having support that you choose and living the life that you want. So we believe that community-based services are the answer to that. We also are talking about the fact that collectively identity has been forged by disabled people. So disabled people, the word disabled people, is a political one, and it sees social restrictions as the cause of our oppression, and the failure to address disabled people's needs and interests is what disables us, not our conditions or our impairments. We also are looking at the ecological issues of our planet. And what we believe is that climate justice is impossible without addressing the barriers and the social restrictions imposed on us. One of the issues we're working on at the moment is co-production. And co-production has many, identities, really. I mean, it's been used to support users to have a say, but it's also been used by local authorities to actually, I suppose, rubber stamp, austerity measures. So what we want to do is we want to look at what really is co-production and get an identity, a collective identity on that, because we believe it can be a very positive thing, but it needs to be a collective identity, and we need to work on that together with different groups, different campaigners, or else otherwise, without co-production, it is just patronising meaningful involvement of disabled and elderly people.
Absolutely, Sandra. Thank you very much. And Act for Inclusion doing some excellent work around the themes that you brought up. So we have Adrian, then Jane, and then Rona, please.
Hi, my name's Adrian. I was an adult social care worker until took early retirement 2 years ago. Also a senior rep in Unison. I'm still a retired member of Unison and a member of Unite Community. I also have a disability. I'm visually impaired, so it was quite interesting working as a social worker, because obviously you kind of get involved with things from both sides, and the way social work has changed over the last 20 years is just beyond recognition. I mean, we were supposed to be there to advocate for the people that we're supposed to support, but we became more and more like gatekeepers. We were very involved in our union branch we got our local authority to implement the Unison Care Charter, which was really good. But it was very difficult with ever dwindling resources and waiting for ages for packages for people either being struggling at home with support from carers, or in hospital or care homes waiting to come out. The charges, kept on going up all the time. And services being cut as well, and so much the way social work has gone has been tokenistic towards the people that we're supposed to support. For example, with carers, you know, they're entitled to a carers assessment under the Care Act. But, you know, when they said, well, what benefit will it be? Well, you know, we can offer you a bit extra support with some other jobs, or someone to sit with you, whatever. But actually, some people they just want some extra money because, you know, they need a holiday, or they need, you know, perhaps take the disabled person on holiday, or do, you know, just the flexibility to you know, actually do what they need to do. But it was very hard to do that. And so
Adrian,
oh, sorry, yes,
no,
beg your
sorry. I'm just getting a note from the signers that we have to try and speak a little bit
slower.
slower.
I do apologise.
No, you have some brilliant contributions.
Yeah,
I just want to make sure that this is accessible for all. Please carry on, Adrian. Yeah,
I'll try and slow down. I do get a bit carried away. Do let me know if there's anything I need to go over. Yeah, so carers need support, and so many improvements, quotes improvements, get dressed up as improvements that really are cuts. And one of the examples is personalisation. Now, obviously, direct payments, all this type of thing is brilliant, and you know, some of the advances that have been made. But what's happened with local authorities is they've traditionally cut services and said, well, you don't need, say, for example, a day centre anymore, because we can give you money to, you know, for someone to take you out, social activities, you know, for whatever. The fact of the matter is that some people have been attending day centres for years, and whilst I don't agree with disabled people being segregated, it's not a simple question of just closing somewhere down and giving somebody some extra money. As has already been mentioned, people need support in order to fund their own packages of care, and people need to keep the contacts, the friends networks they've made through the institutionalised things that they were involved with before. And I think it was Tony mentioned about family and other support networks being, you know, informal carers, as it were, being labelled as, quotes, assets. And that's another prime example. By giving these positive words for things, oh, you know, you've got your assets, you've got your family, you've got friends, you've got blah, blah, blah. You know, it's trying to, oh, actually, I don't need you really, do I? Because I've got all these wonderful people to help me. And it's all about making you feel bad for asking for help and trying to make cuts. And I hope Rachel's still here. I'm very pleased that she's mentioned that she supports publicly funded social care. We don't want money going to to shareholders, and I agree. We should have an agenda for change for all staff, and we should have national standards for care staff, and public funded organisations which are democratically run by workers and by the actual disabled people. But this pandemic and the way the
Adrian,
Tories
sorry, yeah. Adrian, I'm going to have to stop you there. We've got quite a few hands up, but you've made some.
Okay, sorry. I had slowed down because I was worrying about the time. You see.
I know. We can probably bring you back in afterwards. I just want to make sure that everyone gets another.
I understand.
No,
thank you very much.
We'll bring you back in if we have more time. Okay. So can we go to Jane, then Katrina, then Rowan, please?
Hello. I'm Jane Burnell. I chair Keep Our NHS Public Cornwall, and I spent a lot of my life working in services for people with learning disabilities. And I want to say two things. The first is a national thing, and the second a local one. I think we miss a trick. The campaign is ambitious, and we miss a trick if we don't bring in the expertise that traditional service planners have too often ignored. And that's the expertise of people who draw on services, the expertise of their family, friends and neighbours who actually provide most of the services at the moment, and the expertise of frontline care staff. And very often services are designed too much by people like me, distant academic experts, and not enough by the people who are intimately involved with the service. And that might be at an individual level. It might also be at a service design level or a national level, but we've got an ambitious agenda and it's important to use all the expertise that there is. So that's the national point. The local point is really almost a question. Does anybody know what a critical incident in adult social care is and what the risks of having one might be? I ask because in Cornwall 10 days ago, the Tory cabinet announced to the press that there was a critical incident now in adult social care. They announced this in the evening after the day of a full-length council meeting, but councillors were not given the opportunity to discuss it, not even the Tory councillors, and certainly not the opposition councillors. And what it appears to be is that we will tolerate greater levels of risk and that we will reduce demand, and that somehow declaring a critical incident may allow the council to do this. And whatever there's a crisis of in social care in Cornwall, and there are 650 people waiting to be assessed, there are 200 people in hospital who would like to go home, who aren't bed blockers, they just haven't got any support when they do go home, so they can't go there. We've got budget cuts that are actually cutting the social workers that will be doing those assessments. So whatever crisis we've got, we also have a crisis of democratic accountability. And I really would like to know if anybody else has had the experience of having a critical incident declared, and if they haven't, watch out, because you might be going to. We will be campaigning about that, but campaigning is a bit different down here. It's not easy for us to mobilise large numbers of people for national campaigns. It's more scraping away at particular local issues, and we hope that one's got a bit of traction. Thank you.
Thank you very much, Jane. So we have Katrina, then Rona, and then Rob, please. And just be mindful of your contribution lengths. I do appreciate that everyone's trying to speak a little bit slower. So thank you. Over to you, Katrina.
Hi there. I've come from it with 4 hats on. So I'm visually impaired myself. I'm an informal carer to my parents. I am currently involved in a campaign to look at improving rehabilitation services, but I also work in adult social care. However, this evening I am speaking both personally and on behalf of the organisation that I'm involved in the campaign for. So my personal experience as a disabled person, and I think that this does need to be addressed, is that if you show any sign of independence or being able to do something, then they automatically think, oh, because you can do that, you can do this, that, and the other. So there's a great almost lack of awareness, but also it's being used as a way of not providing support. So you almost have to say that you can't do things in order to try and get the help that you do need. So that's my experience as a visually impaired person. As a informal carer, I've had to wait 9 months for a carer's assessment, and although I know how the system works because of working in adult social care. I actually knew more than what the social worker did. So consequently, because I knew how the system works, I was able to go all out sort of thing and really push for what was needed. My concern is that a lot of people don't know what's needed or don't know what they're entitled to, particularly as an informal carer. And then on behalf of the organisation, it's the National Federation of the Blind of the United Kingdom, and we are currently involved in a campaign looking at increasing the importance and number of rehabilitation workers throughout the UK, and also to improve the quality of service as well that's being delivered. And I think this would be a great opportunity for us to get involved. So if it's okay, I will be feeding back to the subcommittee and looking at ways of getting in touch with people.
That would be absolutely fantastic, Katrina. Thank you very much for your contribution. I have Rona, Rob, and then Pamela. And then I think, unless anyone is desperate, I think those will be the last contributions and we'll have a short sum up. I was just wondering if maybe we could open the chat now so people can start putting in their contact details. But please do reach out to naxilservice@gmail.com. Which is in the chat too. Brilliant contributions so far. Rona, then Rob, then Pamela, please.
Yes, hello, my name is Rona Topaz. I am Campaigns and Representations Coordinator for Bromley Experts by Experience. We are a DDPO, a disabled persons-led organisation, and we are campaigning for decent social care and for upholding of the human rights, we're campaigning on behalf of disabled people in Bromley and Beckenham. We have a mental health forum, we have a direct payments forum, and we have a mobility forum as well. And they meet 3 times a year, and what we do is we take questions to various policy and development and scrutiny committees within the local government of the borough, and we ask the local government those questions, which aren't very, it might be a bit awkward, and we get our answers, and we hopefully do something to improve the quality of the lives of the people who are involved in our forums, and for anyone who identifies as a member of Experts by Experience. And it is free to join. So I will be putting my email address into the chat, which I would like NACILS to get in touch with us if that's possible, because we are campaigning on social care. We do have regular questions that come up within the Health and Social Care Scrutiny Committee. They cancel their meeting in January, but they do have regular meetings, and we do ask questions relevant to social care charging in particular. I actually have a question I want to ask people before we wrap up, because I'm a little bit kind of confused about. Oh, I should also explain that I'm a disabled person, obviously, because I work for a DDPO. I'm physically mobility and memory challenged, but I was also a carer for 9 years, and because I'm disabled, being a carer was not easy, because it did take me 9 months to get a social work assessment. And then when I was assessed, because of my disabilities, they tried to take my mother away from me and put her into a care home. And I wasn't having it, and I fought them on it. And she didn't end up in a care home until the last 2 months of her life. And I'm pretty sure that, although I think that inevitably her time was coming to an end, I'm pretty sure that being in a care home contributed to her earlier her death sooner than it would have been. if she had been at home. But yeah, I was actually picked on for being disabled by social work services because there were a lot of questions relating to the quality of the care that she received that were relevant to the fact that I have a spinal disability. So I know that there was a connection. So my question is, the Coronavirus Act, is that still affecting the do local authorities still have the right to discharge care, to wash the hands of care, or to cut back on care services for those that they feel are too expensive to look after? Is that still on the statute books, or has that been sort of removed since we've sort of abandoned the COVID restrictions? So that's my question.
Thanks, Rona. I don't think that there's anyone on the panel who can directly answer that, but that's something that, you know, we should be talking about, and we will raise again. So we've got Rob now and then Pamela, and then we are going to start wrapping up the meeting. We have 10 minutes left. Rob, over to you from Act from Inclusion.
Thank you. Yes, I'm also from Act from Inclusion, but I'm not going to talk about Act for Inclusion because I think Sandra's covered most of the points for Act for Inclusion. Well, I want to speak. I'm a disabled person who was born with a disability, so I've got 60 years of experience of social care, both having it done to me and doing it with me. And I think there has been very much over the past years a venomous mentality when it comes to social care and support. It's the people who receive the services very much in competition with the people who provide the services, and I think we need to break down those barriers and come together and work together. But to do that, one of the biggest barriers, and as a poet and a writer, it's the language we use, because language can be used to isolate and marginalize, but it can also unite and bring us together. So we need to, and it's great that we have so many organisations nationally coming together on tonight's so, but as I said, I do a lot of work in co-production, and I think we all need to work together and basically break down the barriers and live in a society based on equality, fairness, and dare I say, socialism.
You certainly can say that, Rob. Thank you very much. Over to you, Pamela, for the last contribution of the evening.
Thanks. I'm a member of Doctors in Unite, and I've really got a question at this stage in our campaign. I've worked for many years in the NHS with the expectation that if you have high level of need and you need an expensive operation, it will be paid for by the NHS. Now, when we're talking about public funding, I think it's important to have the same approach so that we don't have the basic better best. You can have the basic £600 a week once you've used your £83,000 up. But actually, if your care needs are £1,500 a week to have a well-paid care worker supporting you day and night, you can't have that. So I think we really do need to be ambitious and draw parallels with what we expect from the NHS, and long may that continue.
Thank you very much, Pamela. Absolutely agree. Just to sum up, what a wealth of experience we have on this call. And at our largest, I think there was 100 participants, all with experts by experience, experts within their roles, and also a lot of unpaid carers as well. So I think that, you know, there's a real spirit in this room of coming together to change the narrative and pushing this campaign forward. So I do really want to reiterate, if everyone could put their details in the chat so we can continue this conversation, it's absolutely vital. What I would like to do is highlight 3 subgroups within NACSL's campaign, which are coming up. There's a group specifically targeted at reaching out to politicians and policy. So that is the politicians group, and the next meeting is on the 10th of February at 7 p.m. I hope that someone will be sharing that in the chat as we speak. So if that's your interest or your expertise, please take the opportunity to register for that now. We also have a publicity group, our publicity group. There's already a podcast underway. There's lots of articles coming out, and we're reaching out to both local and national press to try and further the aims of the campaign. If you are a budding journalist, or you think you have something to contribute to that, the next NACSL's publicity group is on the 15th of February at 6:30 p.m. and that should be in the chat now. So hopefully you could register for that now. And the final group, which is a subgroup of the NACSL's campaign, is the trade union group. And we've heard from lots of trade unionists today, Adrian to mention one, Jackie, and this is an active group, and we get together to discuss not only what workers need and our vision for the terms and conditions of workers, but how do we win trade unions over? How do we push for change within our trade unions and further afield? So that trade union group will be meeting on Monday, the 21st of February at 7 p.m. and that will be, the registration is in the chat. But don't worry, because what we will make sure we do is we will get all that information out to you. If you've left your details in the chat, if you are on our mailing list, we'll ensure that all those meetings that are coming up and those opportunities for you to participate and to get involved in the campaign will be landing in your inboxes soon. So I want to thank everyone who contributed today. I want to thank everyone for their resistance locally, be it in local user forums or their trade unions or Doctors in Unite, whatever organisation. Together, we are more than the sum of our parts. So together under NACSL's, I hope that we can come together and really push for the transformatory change that we need in our social support services. So please do stay in contact. We will be getting in contact with how you can participate, and also we'll be making notes of this meeting to highlight some of your ideas and opportunities for action in the coming months. Please stay in touch. There will be ongoing public meetings from NACSL's campaign, and any questions, our email is in the chat, which is naxlservice@gmail.com. So please do reach out to the campaign. There's so much experience in this room, and we have to pull together to fight for that radical change. So thanks very much, everyone. Thank you for your participation tonight. What I'm going to do is close the formal meeting, but what we will do is leave the meeting open for those of you who want to talk amongst yourselves or would like to leave information in the chat until about 10 past, which will give us 15 minutes to do that. I'd like to thank all our speakers for today. I'd like to thank you, the organisers of this event, and I'd also like to thank Craig and Emma, the BSL signers, who have been bearing with us so patiently and ensuring that this meeting is accessible as possible. So thank you very much, everyone. Brilliant meeting, and I feel inspired to go out there and make this happen. So thanks very much from Naxos, and good night. Well done, everyone.